If you experience back pain, you are not alone. A report from the American Chiropractic Association says 80% of the population will experience back pain at some point in their lives.
Yeah, and tonight's Eye on Health, WSBT-22's DAYNE MARAE has more on what you can do to reduce your chances. Dane?
Jennifer Todd, back pain is not an uncommon occurrence. Whether you lifted something too heavy or it's hereditary, there are some things you can do to relieve your pain.
Dr. Michael Hartman is an orthopedic spine surgeon in Goshen, and every day he sees patients struggling with back pain.
Most of the spinal disorders in America are back pain due to slipping forward of the bones on another, or pinching the nerves, having leg pain, or same thing with the neck, pinching nerves in the neck, having pressure on the nerves causing arm pain, or putting pressure on the spinal cord and having weakness, arms, legs.
Depending on your profession or family medical history, some people may be more prone to back problems. And Dr. Hartman says those that enjoy lighting up are putting themselves at an increased risk. You
get decreased blood flow, it dries up the disc, it loses the normal hydration, water, and they degenerate quicker. And so nicotine is the #1 offender. Dr. Hartman also says while you can't help your genetics, you can help yourself. He says being in relatively good physical shape will reduce the stress on your back. You know, if you weigh 300 pounds, well, that's putting a lot of stresses on your disc just as you would on your knees. If you find yourself with limited movement and pain, it's time to see your doctor, who may recommend physical therapy, a very crucial program for pain management. What I found from my own experience from having, some back problems in the past. I thought that I knew physical therapy exercises to do just because, you do surgery, hip bones connect to leg bone, that kind of thing. That's not the case. Physical therapy is something that I thought I knew. The therapist knows their job. I don't know their job. If that doesn't work, surgery may be the best option. If you have issues such as weakness in a nerve, weakness on exam, usually at that point the only thing you can do is surgery.
Now, Dr. Hartman actually had a spine fusion himself and says he was back at work full-time in 3 weeks. Also, some good news. He says wine has been shown to help with disc issues in the back. In the studio, DAYNE MARAE, WSBT 20.